The power of massage and its healing benefits have been known for eons. So to help us mark Therapeutic Massage Awareness Day on May 1st is Dana Ball, director of Carolina School of Bodywork, and her wonderful demonstrator here, Casey Childs. I want to thank you for coming in and talking a bit more about massage, which I think we know a lot about. There's so many different kinds, Swedish, Ayurvedic, Shiatsu, but clinical massage, how is that different?
Clinical massage is kind of rooted in all of the classic massage modalities, like Swedish, like you mentioned. The difference ends up being what our outcome is, or what our end goal would be. So working with people that have like long-term conditions, disorders, injuries, that's where clinical massage really comes in. So the technique is a little bit different and a little more focalized and definitely goal-oriented.
Okay, so someone comes in with an injury, let's say, it's to treat that. So people get massage not just to help with injuries, and it goes well beyond the tissue and also aids in diseases and things like that.
Yeah, manual lymphatic drainage is a technique that we can use to help people that have lymphedema after having lymph nodes removed due to cancer surgery, lipedema, a ton of other conditions that we can be assisted with.
What is it about lymph node drainage that is so powerful for the body and that's so healthy?
It's really popular in people that are kind of post-op plastic surgery specifically.
Really?
Yes. Well,
why is this?
After surgery, you're really, really swollen, and that's a normal physiological response to injuries. So it's to help kind of create more fluid, which has a small amount of immune properties to it, and help you heal faster.
Interesting. All right, so let's talk about Casey here. You brought a few tools, and these are some examples of the treatments that you do teach at the school. So why don't you show us, first of all, what is this thing? It looks like a metal boomerang.
It is. This is a blade. The tools that we use are called Instrument-Assisted Soft Tissue Mobilizing Tools, so IASTM. It's a whole mouthful.
It is.
But what we're looking to do is get kind of tissue to move in a direction that it doesn't want to go in. So this one right here doesn't really want to move down, so we would push the tissue in a downward direction, which is going to cause a ton of vasodilation. So we're bringing blood to that area.
It looks like it hurts. Casey, does it hurt?
I don't know. No, yes, super good.
And then cupping. Now, cupping is something that I've actually tried myself. I tried it around my neck to great benefit. So what is it about cupping, and how does it work that makes it beneficial?
The difference between cupping and traditional massage is we normally work in compressive situations, and cupping does the exact opposite. So we can put space in between the skin and the tissue underneath and kind of move things along.
And that's a different type of cup as well.
Silicone.
It's silicone.
Yes.
So it's not one of those glass that heat up and you draw out the oxygen and all of that stuff.
Fire cupping, yeah.
Cupping,
it's so fun, but I don't like to play with fire, so I stick
A lot of
with
people are
these.
afraid of fire. No pyromaniacs here. And then what is this?
Yes, same ISTM tool. We just have different projections on it. So we have some kind of beveled edges to get on round surfaces, which there are a lot of round surfaces on the body instead of flat surfaces. Yeah. And then we can be really, really specific if we find an area that is super tight.
So you really target that little muscle, that nagging muscle that will just not release. Besides massage, you talk about compression, you talk about the cupping. Stretching is also really important. So show us an example of what you teach.
Yes, so our muscular and nervous system have a physiological mechanism built into it that allows us to move. So without getting super technical, every time a nerve sends an impulse to a muscle to move, it sends the same impulse to that muscle's antagonist to do nothing so that we can move. Otherwise, we wouldn't move at all.
Sure.
So we can use this principle and this law to get more range of motion out of a joint that is a little bit restricted. So we're trying to get to her end range, which is right about here because her knee started to buckle a little bit. So to use this technique, I would ask her to push against me so she's doing the opposite of what I'm trying to do.
How does that help?
It's turning off the muscles that are not allowing her to move. Good, breathe, relax. And then we can move further.
There we go. You know, it's such an interesting and it's an infinite world in which to learn more about your body and how it works. And, you know, we just do things we take for granted and then we wonder why our lower back aches and we don't know how to fix it.
Right.
And you shouldn't mask it with just popping pills all the time. This is a wonderful alternative for people who really want to heal from those injuries, and also for people who want to learn more about how to do it. So you teach people.
Yes.
So you have some enrollment information for folks.
Yes, yeah. I just opened my school in January, so Carolina School of Bodywork.
Congratulations.
And thank you. It's been like a year and a half of kind of getting it off the ground.
Yes.
But I'm really wanted to open the school to teach people how to do this. And my goal is to help as many people as possible, and I can do that if I help other people help people.
That's wonderful. Dana, thank you so much. We're going to put that information up on our screen. Casey, good job.
Thank you.
You did great. All right. So if you want more information on how to enroll and also just learn more about your body and get a massage, just go to their website. We'll be right back.